So Richter's transformation is an aggressive transformation of CLL which occurs in approximately 5% of the patients. And really there is no true standard of care. Patients get chemoimmunotherapy as a treatment. And then if you look at the results, most of the patients, unfortunately, on average, the median survival is less than 1 year. So this is a very tough disease. A few years ago, based on some other data which was reported by the Mayo Clinic group, that the single agent pembrolizumab, which is a PD-1 drug, may have clinical activity in patients with Richter's transformation. We designed this study where we used nivolumab, a PD-1 drug, in combination with ibrutinib for patients with Richter's transformation patients. So we reported at the ASH meeting 24 patients we have treated, and 10 out of 24 patients had a response to therapy. So overall, 42% of the patients responded, and notably 4 of these patients were able to go to an allotransplant. And so that's another feature that, 4 of the 10 who responded were able to go to an allotransplant. In terms of the immune toxicities, which we generally worry about whenever we use checkpoint inhibitors, we saw very minimal immune toxicities in these patients. And most of the side effects were related to ibrutinib, and which are within the line what you would expect with ibrutinib. So overall, I think this provides another approach, a potential approach to treat patients with Richter's transformation, though and it's a chemotherapy-free approach. So this may especially be maybe appealing in situations where you have genomic aberrations such as deletion 17p, p53, where chemotherapy generally doesn't work very well. So at least for those patients, this could be a consideration. So the other things which have been done in the context of immunotherapies are the CAR T strategy. So there have been trials looking at CAR T cell strategy, which is obviously approved strategy for ALL, non-Hodgkin's lymphoma, but specifically treating patients with the Richter's transformation. There was a report from the Fred Hutch group last year looking at that. And then also stem cell transplant, which is a kind of an immune therapy, is also a well-established modality.